We love the profession and are very excited to share it with you. We hope after today you will have more knowledge of what our program and our profession is all about. What we'd like to do today is share with you our team members to start, and then provide you insight into what our program is about, then what sets us apart from other schools, what opportunities are available after graduating, hear from a graduate, Mitchell, that graduated from the program, hear from a manager, Emily, that hires our students, and then answer any questions that you may have afterward. So let's get started. We know that LTC's entire school, staff, and faculty help impact the success of each student. But for time's sake, I will mention those directly involved with the everyday process. I am proud to introduce the team that makes this program a success. First off, I am Mary Walker. I'm the program coordinator. We have Michelle Zautner, who is our Dean of Health and Human Services. We have Brian Rapenchek, who is our clinical coordinator. We have Brittany Coates, who is our adjunct faculty at Nicollet area. We have Brenda Linkford, who is our Health and Human Services Administrative Specialist. We have Mai Yang, who is our local advisor. And we also have a Nicollet advisor named Rob Rhodes. The radiography program prepares students for a career in diagnostic radiology, X-ray essentially, as a radiographer. The radiographer is a technologist who produces images of the human body to aid physicians in the diagnosis of injuries and diseases. Students learn to use X-ray imaging machines to demonstrate body parts for diagnostic purposes. The graduates will receive an associate's degree in applied science. It is a 6-term program starting in January. We follow the Wisconsin state curriculum, which requires a full-time track. And that definitely is what is our biggest challenge with our program, because we have to go full-time, and we don't have a part-time track, which is makes it very difficult. Our program is in the middle of our 8-year full accreditation by the Joint Review Committee on Education. And what they do is they accredited educational programs to promote excellence in education. So we're really fortunate enough to be able to have an 8-year accreditation, and we're right in the middle of that right now. The program, like I said, is a full-time, and it's actually more than a full-time program. We have theory classes in spring and fall. These include subjects like anatomy, how to position the part for the X-ray. It includes some science, creation of X-ray, how to manage the electromagnetic energy, and what the effects are in the body. And it encompasses quite a bit more than that, but that's to summarize it. It also includes more fun classes like labs, where we practice the positioning of parts, different pathologies and how they present on an image. We also learn about all the other modalities, the other areas within the imaging department, how to analyze for quality images. We also learn how to take care of patients' physical and emotional needs while in our departments. Then there are clinical courses. These provide students the opportunity to participate in hands-on training. This is where the students work with technologists to earn competencies. Once they prove competent, they can work with patients with an indirect supervision, meaning they can work with patients by themselves, and it's a wonderful thing. Clinical courses are run all 6 semesters. Fall and spring, they are opposite the theory classes. However, in summer, they are in clinical as much as 37 hours a week. They typically have 1 p.m. shift a week and 3 weekend shifts a semester. By the time graduation is complete, they earn competencies on like many different cases. So I think it's like almost 50 cases, different types of exams. What sets us apart from other schools is we are a shared program with Nicollet College. Nicollet supports our labs and classes at the Nicollet campus. And then the local area hospitals and clinics allow our students to come in have their hands-on experience in the local area. Our program starts in January, which is also a unique to our program. And we offer that so our students have the first opportunity to achieve, to get the jobs that open up and start in January. Because of that, we are nationally, statistics show we are above average in the exam pass rate. Our program retention, of course, not considering those that left because they didn't like it, for 2020, our retention was 100%. We have consistently had a 100% job placement rate, and I think we're pretty proud of that, and that's probably one of the things that sets us apart, I think. Any questions so far? No questions?
Nope, there's no questions so far.
Okay, great. Graduates of the program are eligible to take a certification exam provided by the American Registry of Radiologic Technologists, very similar to nursing. As they pass the exam, they become a registered technologist. The ARRT is the world's largest organization that offers credentials in medical imaging. Employers, state licensing agencies, and federal regulators all consider the ARRT credential to be verification that you've met rigorous professional standards, and oftentimes will be required by employers and be required, by employers. According to the United States Department of Labor, Occupational Employment and Wages, May 2020, if you look at this map, you can see that the dark blue areas are the highest wages. California has about $95,000 a year when you're in radiography. Of course, their cost of living is much higher there, of course, but they get about $45 an hour in California, and they probably need more, I would imagine. Minnesota, their average or annual rate is about $70,000 and $33 an hour in Minnesota. And you can see Minnesota's blue area here. Wisconsin, though, we on an annual basis, the Labor Department said that we average technologist wage is about $62,000 a year, and average about $30 an hour. So I just thought you ought to know that, because that's always a interesting fact. So we are pretty comparable to nursing, and so and we're pretty proud of that. Okay. As a technologist, you can take many professional journeys. So you can work in general diagnostic X-ray. You can get a job and receive on-the-job training to advance into other modalities. You can continue your education towards a specific modality. You can continue your education to a partnered four-year colleges. And let's talk about what those professions are. So working in diagnostic imaging, general radiography is a rewarding profession in that you can work in hospitals or clinics. If you work in a hospital, you will work in areas like fluoroscopy, where you do live X-ray. You can work in the operating room during surgery cases, assist in surgery and in identifying internal structures. You can work in the emergency room, be involved with imaging during trauma situations. And you can work with mobile radiography, take X-rays in patients' rooms, recovery suites, etc. That's part of the general radiography job duties. It also it could include some crossover into other areas. You could work in a field that you travel, mobile radiography, where you work for a traveling organization and travel around the country. So most employers will provide the opportunity to achieve the requirements to obtain a certification, which is an exam similar to the RT exam with the ARRT in CT and or MRI. So this would be considered on-the-job training. Many jobs will do that for you. They'll also do the same for you to get into special procedures where they take a look at the blood vessels in the body. or cardiac cath lab, where you can work in the cardiac cath lab and assist during, ablations and studies like that. Ultrasound tech, and if you want to become an ultrasound tech, you would become a sonographer. Unfortunately, though, that would take 18 more months of school. A nuclear medicine technologist uses radioactive substances and tracers to identify abnormal physiology of the body. That too would require more college training. You would have to go back to school and get a bachelor's in specifically that. Then there's radiation therapy. Now that's another 2 years of training. So what we talked about prior was you would get on-the-job training and you would advance into those areas if you chose to. Some people don't ever want to move. Or you could go on to school and become a sonographer, a nuclear medicine technologist, or a radiation therapist. And again, those require additional education and sometimes specific programs. For example, in Milwaukee, Aurora has a ultrasound school, and you can go directly into ultrasound school from an X-ray program. So these are just a few of the colleges we partner with. So if by chance you graduate and you decide, okay, we would like to move on and get a 4-year degree, and we can do that. And we are partnered with these, and of course our credits will also transfer into many other colleges, but these specifically are colleges that we partner with. So beyond the fact that you can go on to school and specialize in those special areas, which is sonography, nuclear medicine, or radiation therapy, those kind of programs, you can also go on to school and get your 4-year degree, but you can also continue on and become what's called an application specialist. Now, this just requires, I believe, a 4-year degree, and you can become a sales rep, or you can become an application specialist, where you actually train people how to work their equipment. So you would go into the hospitals and clinics and show them, this is how you work your CT unit, or this is how we manage your X-ray unit. This is how we work all the features on your mobile unit. So you would work for like manufacturers like GE, Philips, Siemens. These are all organizations that once you graduate from our program, you could take a few more classes and you could work for GE Medical Systems or these manufacturers and do that. It's a really wonderful opportunity to advance to. You can also, of course, become a teacher. You could keep going and become a physicist. We did have a student that went on to become a physicist from our program at one point. You could go all the way to a radiologist, and a radiologist is a physician that specializes in reading the X-rays. So those are the doctors that read them. It's really endless. There's so many other areas that I could speak to that I would just hate to take up too much of your time on this, but I really appreciate you guys taking time out of this beautiful day to hear about us. But again, it's endless, and I'm sure we have people who can tell you all about that. So what I'd like to do now is transfer you over to Brian.
Hello, I'm Brian Repenchek. I'm the clinical coordinator with the program. I started back in December, so I'm fairly new to this role. But I kind of want to go back, as Mary was just talking about the different avenues that you can take. I kind of want to go back to when I graduated from UW-Stevens Point with a forestry degree in 2000. So I got a job right away, started working in forestry, spent 8.5, 9 years in that field, and there was no ladder to climb. It was a stagnant position. I was a staff forester, and that was it. There was no ladder to climb, nowhere to move within the company. So then 2008, 2009 happened when the economy kind of crashed and I lost my job. And I went back to school. I wanted to get into the medical field and get into something more stable. So I went back to school for radiography through the LTC shared program up in Nicollet. and graduated 2012. And my career has been anything but stagnant. I started working at Marshfield Clinic as a part-time tech, and then went over to the hospital at Howard and started doing CT right away, then became the CT lead there. And then the adjunct instructor position up here opened up, at Nicollet, I should say, opened up, and I jumped at the chance to move into that position. So I did that for a few years, and now I'm currently the clinical coordinator. So anything but stagnant in this field. There's opportunities endlessly. So that's kind of my background. I'm going to turn it over now to one of our other recent graduates, Mitchell Neuendank. And he was actually part of my first class when I started the adjunct instructor position. So he made life very easy on me, and he is a very successful student and person in general. So Mitchell can kind of tell us a little bit about how the program affected him and where it's taken him.
All right. Can everybody hear me okay?
Yes.
All right. First time using Zoom, so. Yep, so my name is Mitchell Neuendank. I graduated from the Nicollet Rad Tech program in 2019. I now work at Wausau Aspirus Hospital campus doing CT scans. So, I mean, first thing I would say too is with Rad Tech, it's such a good fit for some people. Like nursing kind of gets a lot of people going in. It's a really well, I don't know, like talked about program. But also we fit people a little bit better, I feel, just because you only have to take patients for 5 minutes at a time. Whereas, I mean, nurses will have a whole day with troublesome patients. I mean, the community in the Rad Tech program is just phenomenal. Everybody's very tight knit. The program itself, I would say, was very challenging going through, but anybody who's went through it will realize that it goes a lot faster than you would think. You kind of get out what you put into it. I mean, you treat clinicals as a job, things like that. So that needs to be told to the students that it's kind of very important that you treat this as a job. Other than that, I mean, the LTC program, I would highly recommend to everybody. Like Brian was saying, there's never, throughout the COVID-19 pandemic, I mean, multiple people were getting laid off, everything. I didn't miss an hour. I'm on overnight, so I mean, during days there was a little bit of cutback, but I did not miss a single hour. There was no cut, so in that there is definitely something to be said. Yeah, and I mean, I guess other than that, I mean, I would say the program prepared me for my board. I mean, the main thing is get your hours in, try and impress everybody that you can, and then take your your X-ray certification. So in that, I think they did a very good job. Both instructors did well to prepare for that, and just know the expectations. Ultimately, it falls upon the student though too.
Thanks, Mitchell. And I guess one thing that didn't come up kind of in the presentation, but as students get into our LTC program, they have Mary and I and Brittany, the adjunct instructor up north, for that entire 2 years. We are their core group that they will be learning from, aside from their clinical sites and their clinical instructors at their clinical sites. So with that, I will turn it over to one of the clinical sites, Emily Domovich at Aspirus, and she can let you know a little bit about how the program works with the sites.
Hello, my name is Emily Domovich. I am the supervisor for both Aspirus Rhinelander as well as Woodruff clinics. Myself, as well as all of the techs on our team, work closely with our students. Typically, we get students on a rotating schedule. It's not always the same. Students come to us typically at a 2-week interim with sharing of other sites, whether it be hospitals or other clinics. Here at Aspirus Rhinelander, where we get our students, we have a multitude of opportunity to for our students to learn. We have anywhere from family practice to a walk-in clinic, as well as specialty. Specialty can range from spine and neuro, foot and ankle, GI, or surgical associates, which really gives our students ample opportunity and versatility with seeing everything that they really need to see in their schooling. With that, being in a clinic, I can't speak much for a hospital at this point, but being in the clinic allows us opportunity to spend one-on-one time with our students at a fairly consistent basis. You know, in healthcare, it's feast or famine. On slower days, there's opportunity to grab other texts and practice, maybe things students don't know. Allowing time to go over certain exams with students or do image analysis of some kind, allowing them ample opportunity to learn in those scenarios, where a hospital may be a little bit busier, not allowing that time with those students. With the amount of time that we spend with our students, it really kind of helps us learn who they are and how they work. So at the end of their 2 years, once we kind of evaluate how much they want to learn, how hard they work, how much they've grown, and their ability to take constructive criticism really kind of helps us determine if there's job opportunities we love to pull from the program, partly because we know them and we've worked with them for a year or 2 years, but also because we've trained them. So they are ready to work. They know the expectations with the job. And we basically have done a 2-year interview with them. So we love to pull from the program if we can. Mitchell was one of our students at Aspirus Rhinelander, and if I had a job, I would have offered him one in an instant. The only reason I gave him my approval is he stayed within Aspirus, so he's still somewhat on our team. But in regards to the curriculum that the students learn, it really piggybacks to what we do here in the clinic, which is extremely beneficial for those students to get the hands-on with the patients, with what they need per exam, but also give them that practice of simple tasks of learning how to communicate, learning how to talk, learning how to touch patients, and not feel weird about it. It's a very hands-on job, which sometimes takes time to learn. But with that, we have a great working relationship with LTC. And I feel, you know, based off of the last 6 months to a year, Brian and I have kept pretty consistent communication, which I think has really helped push the program forward. We just need some more access to students. My one recommendation, if you have students who are interested in healthcare of some kind, if they have any interest at all in X-ray, MRI, CT, ultrasound, nuke med, any of those things, reaching out to one of the schools and get them in to observe for a couple hours, just to kind of give them a better idea of what it all entails, so they know what they're getting into. So that is all I have for now.
Mm-hmm. Thank you. Thank you, Emily. Nice to see you, Mitchell. I haven't seen you in forever. Nice to see you, Emily. So with that, you know, it's great to see you guys. Thank you for your input. Does anybody else have any questions or anything that you would like to ask Emily or Mitchell?
Mary, there was one question in the chat. Can you talk about the waiting list? They understand it's pretty long here at LTC. Is it different at Nicollet?
It is definitely different at Nicollet. Nicollet, we only take 5 students every year in Nicollet. And the problem, though, is people didn't really know that much about our program up in the Nicollet region. And it's really, we want to promote that more and want people to know that we do exist. And if you are interested in it, you don't have to travel and go away to go to school to go for the program. You can do it right in your own, area. So our wait list is a matter of not only local, but also Nicollet. The wait list is all based off of who gets their stuff done first. really. Whoever gets their prereqs done, we encourage people to get certain stuff out of the way right away. You need to take a CNA course. You need to take anatomy and physiology. You need to have a chemistry. You need to have these requirements completed. So a lot of these can be done in high school. So we are encouraging people to please encourage your students to take these courses if they are interested in X-ray in high school and get those out of the way. Biology, they need to take, so what we're encouraging in the wait list isn't as long as it seems. So the local area, yes, there is, we only take 10 people at once. So the local area, there is a little bit of a wait list. I think we're about a year or two out. But Nicollet, I think we're not but a year out, not at all. So, Did that answer your question?
Yep, I don't see any other questions.
Well, I really appreciate everyone's time today. We love our program. We love, our field, and so we're excited to be able to have the opportunity to talk about it. And we are available at any time to meet with anyone to either do a job shadow, or if you want to come and come to a clinical site, we can work that out as well. If you want to come to any one of the classes, or send a student to us to have to visualize a class and watch a class, we're more than happy to do that as well. So please let us know if you have any questions going forward, and we'll be available.
Mary, there was one more question. Are any of these jobs in high demand?
High demand. Emily, what do you think?
That's a difficult question. I guess it depends on the student. If you have students who are willing to travel, there's absolutely high demand. In the clinic setting, I would say probably not at this point. It's difficult to answer fully due to COVID, but it is an ever evolving process. So I know a lot of times in the hospital, there is typically a demand of some kind, more so in the city versus in the northern region, in my opinion. So if you have students who are willing to travel a bit, at least for a few years, to get that experience, I absolutely think that there would be no problem getting a job. But just as any other career, I would say it goes in ebbs and flow, highs and lows of, there's years that we're begging for help, and then there's years that we don't need help. So it's a difficult answer to give based off of COVID, because everything is sort of not status quo.
Thank you. I did look at the National Bureau of Statistics, and they do show that there's an increase, about a 9 to 10% increase they're projecting in the next couple of years for job placement. And we have not had any trouble with people getting a job. Mitchell, how about you? Did you have any trouble getting a job? Well, you, of course, were an exceptional student.
Yeah, I got a job right out of graduation. So I had something lined up prior to graduation even. I would say, like Emily said, as long as they're willing to travel, things like that. Since it takes a certification to be able to do our job, it's a little harder to fill when people are out. So where there is demand too, just got to be very kind of open for travel, things like that, I would say.
In all the years I've been in the field, it's gone up and down throughout the years. All of a sudden, they're giving $10,000 sign-on bonuses, and then next thing you know, they're not. And then everybody's looking for work. So it goes and flows. Yeah, just like Emily said. Anything else?
Nope, there's no other questions in the chat.
Wonderful. Well, thank you everyone for your time today. I appreciate it. And if you please don't hesitate to reach out if you have any further questions or anything that we can do to help you understand our program. We'd be happy to do it. Have a good day.
Brittany, can we put our contact information somewhere where everybody can see it?
Yes, I will send you the email address. I'll get that all put together and send that to you.
Okay.